I'd like to present County Judge Richard Cortez.
Well, good morning, everyone. Thank you for being here. As you know, Sunday we reported over 400 cases that tested positive for this virus, and we've never seen these numbers before. The numbers continue to escalate, it seems like, every day. Unfortunately, I've had some friends and acquaintances that have received this virus and are very seriously ill. They have told me that they wouldn't even wish this on their worst enemy. It's been a very, very painful process. When March hit and we had our first positive test in Hidalgo County, we thought that based on all the experts, that the best thing to do was to take the necessary precautions to try to limit the spreading of this disease, and we did. One of the goals was not to overwhelm our healthcare providers and our healthcare industry with this virus. Today, we find ourselves very close to reaching capacity where our healthcare providers are having to take a lot of necessary steps to be able to care for those people that need to be cared for. In the last week we had several telephonic conference calls between the administrators and the office here in the county, and we started to learn some of their needs, some of their problems, and we're in this thing together, and we're going to solve this situation by working together. So it was very important that we continue this dialogue so we can understand the needs that we have. As a result of that, last Friday late evening, I wrote a letter to our governor, the head of healthcare in Texas, and the head of emergency management in Texas, soliciting help for our hospitals because we were running short of staffing and other types of supplies and equipment. To my surprise, to my happy surprise, they responded very quickly. We have already received positive confirmation that at least 2 of our hospital groups here in Hidalgo County will be receiving support. Today, I invited hospital administrators to come to us. You know, they are our trusted advisors. There are our people that are entrusted with our well-being. And we want to hear from them, and we want you to hear from them as to what their needs are, what they recommend for you to do to hopefully, put an end to this nightmare that we're having. So with that in mind, I want to just simply start first, before we turn it over for discussion by each CEO, is just to introduce everyone here, and I'll start to my right with Commissioner Torres.
Good morning. Good morning. My name's Ellie Torres, and I'm Precinct 4 County Commissioner.
Good morning. My name is Ivan Melendez. I'm the Hidalgo County Health Authority.
Good morning. My name is Lance Ames. I'm the CEO with South Texas Health System, Edinburgh, and Children's Hospitals.
Good morning. My name is Chris Rivera. I'm the CEO at Rio Grande Regional Hospital.
Good morning. My name is Kane Dawson, and I'm the CEO at Mission Regional Medical Center.
Good morning. I'm John Krause. I'm Dean of the UTRGV School of Medicine, Executive Vice President for Health Affairs at UTRGV.
Good morning. I'm Joe Rodriguez, CEO of South Texas Behavioral Health Center here in Edinburgh.
Ricardo Saldaña, Emergency Management Coordinator, Hidalgo County.
Okay, we'll give Dr. Martinez just a moment to find his seat. Doctor, if you could please introduce yourself.
Robert Martinez. I'm the Chief Physician Executive of DHR Health. Thank you.
All right. Thank you very much. Lance, we'll start with you.
Sure. So it's great to be with everyone this morning, and I think it's been a inspiring scene to see all of the administrators from all the different hospitals working together, and we're certainly grateful for Judge Cortez for bringing us together to talk about the significant issues that we are having in our community with COVID-19. As we've all been working together, we've definitely identified resources that are needed for our community and have come up with some solutions that I think will be very helpful. The top need that we see right now is staffing across all hospitals, and the request that the county has put in and that the hospitals have each individually put in for additional staffing, I think is going to help all of us a lot. We don't have a definitive date when those nurses are going to arrive, but our understanding is that we should be getting at least 20 plus to 50 nurses to help our hospitals within the next couple of days. And so that is going to be a welcome sight for all of us. The reality that we see within our hospitals, and speaking for South Texas Health System, is there are a lot more cases coming in right now, whereas a couple of weeks ago, as a hospital, we were doing very good. We had a lot of open beds. Recently, within the past week and a half or so, we have seen the COVID-19 cases in our ERs and in our inpatient units really rising rapidly. And so this is to the point now where we're having to be creative with the resources we have, and it's stretching our systems, staffing, other resources very, very significantly. And so with all of us here today, I think we're here to just share some of that urgency of the situation in the community and the need for us all to follow the basic precautions that the county has outlined for us so that we can all be safe as a community and be able to maintain the resources that we need for our hospitals.
Thank you, Lance. Chris?
Thank you, Judge. I'd like to thank you, Judge Cortez, Commissioner Torres, and Chief Saldana, and Dr. Melendez for your leadership in providing guidance and information to our Hidalgo County residents. And it gets extended throughout the Rio Grande Valley, so thank you very much. Again, my name is Chris Rivera. I'm the CEO at Rio Grande Regional Hospital. And my message is very similar to what Mr. Ames just described for all of you. We do have the need to make sure that our hospital, along with all the other hospitals in the Rio Grande Valley, are well staffed with not only nurses, but all the ancillary support staff, respiratory therapists, pharmacists, medical technologists, and so on and so forth. And I think that with this COVID-19 pandemic that we're experiencing worldwide, nationwide, and then specifically here in the state of Texas, and even more specifically here in the Rio Grande Valley, it's a very important situation that we're all experiencing. And I think that we need the support of the community. Help us, help you, especially when you need care at any one of our facilities. We need to make sure that all of our staff is well equipped with their personal protective equipment, and we thank our county leadership for helping us with that. We do need the staffing, and we do thank the county leadership and the state leadership in helping deploy some nurses to our area. But very basic needs are the fact that as a community, I'd like to request that you do consider utilizing universal precautions to keep everyone safe. It's very simple: wearing a mask, hand hygiene, social distancing. I know that you've been hearing this over and over and over, but it's something that if you're able to do that, it will help tremendously the situation that we're in combating COVID-19. Thank you, Judge.
Thank you, Chris. Okay.
Yeah, good morning. Kane Dawson, CEO of Mission Regional Medical Center. I think the facts have been laid out very clearly. Our issues with capacity are very complex. Hospitals have beds. We're ramping up with staffing, but there's a lot of downstream shortfalls in terms of durable medical equipment and other things we didn't anticipate. And we need to be able to get those patients discharged in order to create capacity. I'd like to also, talk about family gatherings. As much as we love and enjoy that, I know our experience at the hospital, we're seeing whole families come in, and that's tragic and it's difficult. We want to see, upcoming 4th of July, people to just be cautious and practice safe distancing. So that's my message. Please take it to heart. Thank you.
Judge, thank you very much for the invite this morning. And I've got to start out by thanking you, your team, Commissioners Court, the teams in Cameron County for the proactive nature of your leadership. I've gotten a chance to thank Judge Trevino over there as well, and I believe you and Judge Trevino have exhibited the most proactive nature and characteristic of anybody across the state, and it's going to help us save lives, and that includes the team. Commissioner, thank you as well. And thank you for the invite this morning. My message to obviously reiterate what's already been stated, but it's also to let y'all know this is a regional issue. This is not a Hidalgo County versus Cameron County issue at all. We happen to have a micro hospital in Weslaco, but we have our two main hospitals, one in Brownsville and one in Harlingen. And we're seeing the exact same type of pressures being put on our healthcare heroes on a daily basis that have been described already this morning. The reality is this. We have our challenges in Cameron County with South Padre Island with the 4th of July coming up. We have our challenges across the region with our penchant for pachangas, right, and backyard barbecues and those kind of things. There is no time to waste to enact and implement the best practices that have been outlined and shared with our general public thousands of times by now. Everybody's tired of wearing a mask. I get it. Everybody's tired. There's a COVID fatigue that exists in our communities right now. But the reality is we are worse off than we were when we thought we hit our peak in early May. And the numbers continue to rise. I can tell you over the weekend our numbers did not go down in Cameron County. Rather, they went up. And so as we're facing this challenge, we want the general public to know that the healthcare workers being represented here, our healthcare systems being represented here at this table, we have the blessing of working with heroes every day we go to work. Every member of our healthcare team are heroes in regards to what they're doing for our public every day they go to work. As Chris indicated, what we're asking our folks to do is help us, help you, by doing the things that we know work. And we know they work because when we did them in early April and May, we stamped the curve down. And if we've done it once, we can do it again. And we don't necessarily need to wait for the governor to issue an executive order. Every single hospital at this table on our own has continued to increase capacity, well beyond the 15% that was designated by the governor's office. And we're doing it because we understand that's our responsibility, to take care of our communities. But our community now needs to take care of the people that are helping take care of them, and those are the folks on the front line. So message is simple. This is a regional issue. It has to be handled regionally. We are working as a regional team, I can promise you. We're committed to doing so, but we need that same level of commitment from our general public. And for those, by the way, I think it's important to note that the majority of our folks are wearing masks. The problem is it only takes one person in a crowded environment not wearing a mask, not following the best practices to increase the spread of the COVID virus. So until we have 100% compliance, we will not reap the benefits as we did through April and early May. God bless you guys. God bless our community, and thank you for covering this. By you being here today, you're helping us share this message. And thank you again, Judge, for the invite this morning.
Thank you, Mr. Ronnie. Doctor.
Judge Cortez, Commissioner Torres, thank you so much for inviting me. Thank you to for all the good work that the Commissioner's Court and all of your personnel and staff are doing. I wish I could be here under better circumstances, and certainly it's not a good time for us. 1 month ago, we felt that we had COVID under control in the community, and look at the difference even 1 month has brought to us. When we began to allow the communities to open, which we needed to do in some way, there was a predictable rise. I don't know that any of us could have anticipated it would have been at this rate, though, and would be in a situation where all of our hospitals are just overwhelmed with the volume. We can't ignore this. We really can't, because if we continue the way we are, these cases are going to rise. We're going to continue to overwhelm our scarce resources. We are going to have serious illness and death. So I want to make it clear to everyone, the responsibility to get this under control rests with each and every one of us. It's an individual responsibility. And we have within our power the ability to do that. We know how, and we need to act in that way at this point. We've been finding in our testing results very staggering things. We've been finding infants. We had a 6-month-old infant that was tested positive last week. We find young people not only getting ill, but getting seriously ill and dying from this disease. And I want to make that very clear to the young people who might be listening. This is a disease you can get also, and you can get very sick, and you may even die from this. But even more than that, you take this home to your families, to your parents, to your grandparents, and that's not what you want to do as a young adult. You don't want to take a risk with your parents and grandparents of getting this terrible illness. So what can we do about it? We know what we can do. This is a virus that spreads easily when people do not take proper precautions. So first of all, it does not restrict itself to any age, any group, any gender, any part of the community. It's here among all of us. Secondly, we know that there's evidence on how to suppress the rate of this disease. We can wear masks, and it's important that we wear masks and face coverings. We need to practice social distancing and stay 6 feet from others. We need to wash our hands frequently, using hand sanitizers, using even soap and water, and we need to avoid congregations that are larger than 10 people. We need to just be smart about these kinds of things. We know this is a time of great celebration. We know that the Independence Day holiday is on us, and we certainly want people to celebrate and enjoy being together, but do it wisely. Do it safely. Do it in a way that protects not only yourself, but others as well. We know that there's been a rise. We at UT Health are seeing over 10,000 calls a day to our patient call center about people who are concerned about COVID-19. We have tested over 20,000 people now. And today alone, we have 1,000 tests of people in the valley that are scheduled. This is a growing problem, but we need to be able to get it under control now. So please, and again, thank you again for the media being here today. Please get the message out. This is an issue where each and every one of us is responsible for getting the problem under control. Wear masks, wash hands, socially distance, stay safe. Thank you again, Judge and Commissioner. I'm happy to be here today.
Thank you, Doctor. Yes, Doctor, please. Or Mr.
Thank you, Judge.
Rodriguez.
Thank you very much. Ellie, thank you so much, Commissioner. Dr. Melendez, thank you very much. Thank you all for being here today. I'm going to be a little bit different here because I'm dealing with behavioral health patients in the community. So we're seeing patients from Brownsville to Laredo, Kingsville, Corpus Christi. Just to tell you, this weekend we had a total of over 30 admissions that came into our hospital. So we are seeing more and more behavioral health patients coming into our hospital that are very sick. Simply because of this COVID, they're not able to keep their appointments, not able to be keeping the appointments with their psychiatrist, the local mental health authority. But we're seeing some of these patients that are becoming very sick. Unfortunately, these are some patients that are not going to really practice any type of social distance and sometimes not wear the mask. So it's extremely, extremely important that the media get out there and talk about mental health and how it's impacting our community. We're seeing some cases that are very difficult to work with. Patients that are becoming with severe anxiety, with some severe depression, that are suicidal, homicidal, simply because they've been locked in for several months, and for them the social isolation really just becomes more of a paranoid situation. So it is very important for me and to let you all know, the community, that we're in a dilemma with when it comes to behavioral health patients. There's some major issues that are happening right now as a result of this COVID. So I asked again. We talk to our patients every single day. Wear your masks. Unfortunately, some of them don't want to, but they hear conflicting stories from different sources. So it's important that we all keep the same story, the same consistent story, to tell them about wearing your mask and practice social isolation. But more important, to talk to the mental health patients, talk to the mental health community about there's help available. Unfortunately, what's happening, they're going to the emergency departments, and that's not where they need to be. I think it just creates more problems for them. So again, I ask for your support. Whatever education in the community on mental health, we're there, we're available, we're open 24 hours, 7 days a week, but we need your support and we need your help. So thank you.
Thank you, Mr. Rodriguez.
Good morning again. This is Dr. Robert Martinez. I'm the Chief Physician Executive at DHR Health. And first of all, I'd like to commend the judge and his staff and the commissioners here for having the foresight to hold this informational session this morning. I think it's very helpful and shows the community is working together. And that's the first step in making sure that we're doing everything we can to keep our community safe as fast as we can. And I'm not going to echo amount of information that everybody just told you. However, a couple of points. And I think most importantly, we have to remember that individually and personally, this is up to us to solve. The hospital's not going to solve it. The judge isn't going to solve it. I'm not going to solve it. Really, the power is in our hands to be able to take care of it and fix it and make it go away. A little uncomfortable and untimely, but we have that solution, including masks, social distancing, and washing your hands. And so, more than anything, we need to be respectful. It's an issue of taking personal responsibility and not being selfish. Not being selfish by not putting on a mask, going out when you don't need to be, and maybe because you won't get sick doesn't mean that your grandmother's not going to get sick. So people need to think about those messages. I know we can do it, and I'm sure we're going to do it, but we need your help. Again, I can't stress enough, talking about mental health, it's a difficult situation dealing with these patients. We have a lot of them, probably 100 right now as we speak, including our new unit, second new unit. It takes its toll on the healthcare providers, everyone, whether it's EVS, nursing, security. When your own staff becomes mental health patients and they start to have issues, that's the level of severity that we're talking about. And I know everyone in every system is having that issue. So very stressful, very stressful. We don't want to be doing that to our system. Again, some of the things that we need your help with are making sure that you stay safe and you heed the warnings. Listen to what the county's telling you. Listen to what your officials are telling you. And certainly your healthcare providers that are taking care of a loved one. When a loved one goes to the hospital, it should be because they need to receive acute care treatment, real emergency room treatment. Otherwise, we're just filling those emergency rooms up with patients that don't really need to be there for minor symptoms. The emergency rooms were made for sick patients. We'll take them all and we'll see them all. Everyone here at this table will agree. But again, if you don't need to be there, please find another way to get your information. Most of the hospitals, while they would love to be testing sites and screening sites, are not. They're a place for acute care. Luckily, we have UTRGV here to help us with that, with a lot of that screening. Other thing I think are important when I look at roadblocks to moving more patients through the system, be prepared if a loved one goes to the hospital to have plans or to make plans for those people to get home or transition back to their nursing home or wherever. We're having a lot of issues, probably because people are scared, of getting those patients back home even though they're safe to get home. And so please work with us to be able to get those family members back home or to whatever place that's safe for them to go. But that's been a big issue for us, and certainly we have a limited number of beds, so we want to help you and your loved ones. But please be patient with the physicians and the nurses and the staff. It takes extra time with extra dedication and extra concentration to be able to take care of these patients. They have to get, nurses have to get dressed going into the room, get dressed coming out of the room, and that can take an extra hour or two every day for those professionals. And so let's be patient. Everybody's trying to do the safest thing for you. Again, I want to commend the judge and his staff and commissioners for having this meeting today. I think we're headed in the right direction, but we certainly need to take some personal responsibility. Healthcare systems will be there if you require acute care.
Thank you, Doctor. Dr. Melendez.
Ivan Melendez, Hidalgo County Health Authority. In 1968, I rounded at McAllen Hospital downtown with my father. In 1989, I came back already well en route and rounded at McAllen Medical Center in 1989. When I first started out professionally, it was when we were starting out with the HIV crisis. Now I'm in the twilight of my career after 36 plus years, and I dye my hair, in case you're wondering. But the reality of it is, guys, is that I have never, ever seen...
It's good that you have some. Okay, good.
Let me button up my shirt. The reality of it is, ladies and gentlemen in the audience, is that this is unprecedented. I am incredibly proud of what I see as a tremendous, and I think the two words are collaboration and cooperation. I have the privilege of rounding at all the hospitals, and of course, there's always some natural competition between the hospitals, and competition makes us good. But this is also unprecedented, the collaboration and the cooperation that I'm seeing amongst all the people that are here. If I was in the audience, I would like to know the following. Yes, it's a personal responsibility. We all agree. Yes, the only people that can write the ending of this book, of pandemia in 2020, 20 are the people in the community. That book has not been written. The chapters of that virus getting into the community is long gone. Those chapters are written, it's in the community. But the chapter, the end of where are we going to go with this, where is it going to end, it's still being written. These 2 weeks that are coming up are dramatically important. I cannot emphasize how crucial these next 2 weeks are. And even though the resolution, the solution of the problem lies in the community, we as your healthcare leaders, the representatives of the local hospitals, we have a responsibility too, and that responsibility is to be leaders and to help direct and guide and educate, and that is the purpose of this meeting today. We have, I can tell you, the unmitigated or I don't know what the correct descriptive word would be, support from the county commissioners and the county judge. They have listened every way along the way since March 21st, what the local community's recommendations have been toward where we need to go with this. They listen to the experts. They weigh what other financial impacts they may have to wear, but they listen to, first and foremost, what's in the best interest of the community. I can tell you by being in many of these meetings, there's not a doubt in my mind when I go home at night that these folks here have a number one priority, and the folks sitting next to me on both sides, which is the health care of the community. Above money, above financial gain, what is in the best interest of our folks, because we live here too. Our moms, our parents, our kids. We all share the same desire. And I'm very proud of the very difficult and courageous decisions that sometimes have been unpopular that we have done. I want the audience to know that we have met before. There's continuous dialogue between the hospitals and the county. And these dialogues have led to really excellent recommendations. The understanding that some people could go home quicker if they only had access to oxygen, as was mentioned in previous meetings, is being addressed. The state, after we requested, has committed to giving tanks, giving us oxygen, giving us concentrating pulse oximetry. The idea of clogging up our emergency departments with hemodialysis patients, which, as you know, we're one of the poorest counties in the nation, that's been addressed too. The 3 major dialysis folks have, 2 of them have established their own COVID units. Another one has been able to use the Obamacare during the enrollment period to establish COVID sites. We're currently discussing with the National Kidney Emergency Foundation to help us to guide these resources. The premier and most difficult resource to obtain is the human resource. Those folks that are watching people die alone without their parents being there. Those people that are seeing hand-to-hand in the pane of the windows at the nursing homes. Those people that are suctioning people, intubating people, picking up from the streets. The epidemiologists in our office that are working tirelessly. The folks that are doing the testing. All these folks, we've identified that they don't grow on trees. You just can't order some. And so when we discuss alternative testing sites, when we discuss other creative things to do, people not being able to go home, as Dr. Martinez said, perhaps establishing hotels where people can go to until they get a little bit better before they go home. The alternative treatment sites, which we are there, we've requested already, the dialogue is ongoing. We are past the point people say, well, what is the criteria for the healthcare leaders to start talking about an alternative place to set up seeing patients? We're past that. We've already gone past that. The idea that we could not get reagents and that the folks in the hospitals had a difficult time in getting these reagents to get your tests. Remember these PCR tests, as Chris Rivera can tell you, step by step by step by step. These are complex studies. So fortunately, I'd like to recognize UTRGV, the outstanding support that they've given us. Without them folks, I don't know what we'd be doing. They've really come to the plate, have really helped us out tremendously. I want the folks out there to understand that there's so much misinformation out there. If you get a Petri dish and you put it 2 feet away, 4 feet away, 6 feet away, 8 feet away, and you talk in front of the Petri dish, or you cough or you sing or you yell, and you wear a mask and you don't, all the way up to 6 feet, you're going to see growth on that Petri dish of bacteria that's coming out our mouth and our nose. When people say masks don't work, that's ridiculous. I mean, we're seeing it right then and there. When people say it's conspiracy, it doesn't exist, they're really exaggerating, my response would be, come to our emergency department where we have 5 people on ventilators for 3 days. Now, come to the 3 floors that we've had to use to put these people in. Come to all the healthcare workers that go home every night, every little cough, they're sure they have it. We're in tough times. But I want the public to know the following. Are we prepared? Is it safe right now for someone who's sick at home to go to the hospital? Absolutely. The people that think I shouldn't go to the hospital, they can't take care of me anyway, it's overburdened, it's too dangerous. Absolutely not. If you think you need to go now before you get worse. That being said, we have to be nimble and we have to adjust to these astronomical numbers that we're seeing, never seen before. And that's what the purpose of having the leaders in this community come together, identify the problem, and establish plans. So I would like to leave you all with that thought. I would leave the community with the knowledge that absolutely, right now, we're ready. But we really need your help, because if the numbers continue the way they have been the last 2 weeks, it's going to be extremely difficult to provide the care that you all deserve. Thank you.
Thank you, Doctor. I want to recognize the head of our health department, Mr. Eddie Olivares. Eddie, welcome. Before we move on for questions for the press, trying to learn your business, it's difficult when government puts restrictions on you, because you have spent all your life learning how to manage your business, and you have a restriction now to withhold 15% of your rooms and eliminate elective procedures or surgeries to be able to have availability. Would it be important for you to eliminate this requirement so that you can manage that situation yourselves, or this has not been an impediment to you? The reason I ask that is because I want to advocate for what your needs are, because for you to do better, for you to be in a better position than you are today is where we want you to be.
I can certainly speak for us. I think we've worked hard to be able to manage appropriately the needs of the patients in the community. I think, again, it is up to us to be able to make sure we're not burning through that. So I think the way it is now, I think, is appropriate, because one of the other issues, as most of you in the room know, we need to be able to deliver regular health care. And when I mean regular health care, I mean strokes, heart attacks, cancers that have had to wait when there's been complete bans on procedures. That's a real risk, because all of the concomitant disease that we see, diabetes, hypertension, heart disease, those have endpoints, and they come, and we need to be able to deal with those endpoints. And so sometimes it may not be an emergency, but it's very, very urgent that that patient have that procedure done. And it can save a life or, determine your 5-year mortality rate. So I think having some flexibility like we've been able to manage personally, and be able to deliver the urgent care that's necessary, as well as those that are kind of a little bit in the gray zone, where patients will definitely be better making a decision and being able to make that decision for a cancer in particular.
Okay. Anyone else?
I'll agree with Dr. Martinez on that. We've been focusing on still being able to provide those elective procedures for conditions that are still urgent and that are needed. When you look at the resources required for elective surgeries, or for just surgeries in general, it's different than what we need in the ERs and in the inpatient medical telemetry units. And so even if we were to have the nursing staff or the technologists that are in the ORs, they aren't necessarily trained to be able to do medical and telemetry services, or to go into an ER and to know what our ER nurses do. So allowing them to maintain their function for the community is actually a great benefit for everyone. And that's, so far with the PPE, we've had sufficient PPE to be able to continue with those surgeries and maintain them at this point, as well as our ER and medical services.
Okay.
And Judge, if I may add to that, I think that it's important for us to continue working collaboratively, and I think that this has helped us be able to do that. And one way that we can work collaboratively is to be able to take care of the community here in the Rio Grande Valley by establishing our own processes in each of our facilities that manage the decisions as to whether elective surgeries need to be done or not. And we need to be allowed to have that autonomy in order for each of us to be able to make those decisions. At Rio Grande Regional Hospital, we've established a surgical advisory group that meets on a daily basis. It includes our chief of surgery, our chief of anesthesia, our chief of medical officer, our chief nursing officer, our OR director, and the surgeons that are scheduling those cases, because those individuals know what is best for their patients, and we assess whether that patient's condition can hold off and do the elective surgery at a later date, or if it's something that needs to be done. So when we have those processes in place, I prefer that we have the autonomy to be able to make those decisions within each of our individual hospitals. And I think that will help us, all of us, be able to serve our community much better. Thank you, sir.
Thank you.
If I may add as well, I think all the health systems are testing surgical patients ahead of time. And we've come across many asymptomatic patients who are positive. And so we have very safe precautionary measures to prevent exposing staff or any other community members. I just wanted to add that. Thanks.
Thank you.
Judge, if I might, the only thing I'd add is that I believe what the governor expects is proactivity on behalf of the healthcare systems. And to Chris's point, I believe the proactivity that we have exhibited in the Rio Grande Valley to this point is probably the reason the governor's not issued an executive order in regards to those type of procedures here in the Valley. Having said that, I think we can also say in good conscience and in confidence that in regards to the 15% carve-out, I've been on calls with this group. I've been on calls with the group from Cameron County, and I can tell you we've not seen that as some kind of a ceiling. People in this room, people in Cameron County have opened new wings, have created new COVID beds to try to meet the demand. And I think the way we've put this is we're managing the crises as we sit here today, and we're working hard to do so. The reality, there will come a time when our capacity is absolutely at its peak. And that's what we're trying to avoid or avert, is that particular crisis. And so that's the main message here today, is help us avert that kind of a crisis. We're doing what we need to be doing proactively, voluntarily. As I referenced, we didn't wait for the governor to issue an order for us to do this. We're doing this because we are dead set on taking care of our communities down here. So hopefully that insight helps a little bit.
Thank you. And anyone else? Let's talk about transition. Again, I'm trying to get information as to what the needs are and also where to allocate or look for funding, because everything costs money, as we all know. Let's talk about transition. As you're transitioning patients out of the hospital, I've heard the need for oxygen. I've heard the need for dialysis. I've heard the need for behavioral, mental situations. Is it best to have an alternative facility, let's say, because you need critical mass to make it efficient? It's really inefficient to have very segregated areas. Would it be more efficient if we were to say, hey, we're going to have a transitional place to move these patients, and then from there kind of stage 2 to stage 3, stage 3 being home, stage 1 the hospitals, stage 2 in a transitional period? Does that make sense at all? I mean, I'm trying to learn from the experts here.
And I think, in my opinion, I think that we do probably have a need for some of that. It's consolidated resource, because while right now we're starting to see onesies and twosies, they're gonna come up. Again, I'll give you a couple of quick examples. We have a husband-wife team who's there, elderly, sick, with nobody to care for them. Those are the folks that sometimes when they get cleared medically are going to be debilitated, and you're going to need some working on still after the acute need for the hospitalization is done with. That's one example. The other is, somebody at home can't take care of the ill patient for an amount of time. The goal maybe a month from now would be when he can get up and move around on his own to transition home, but the need in the middle is something that's coming up. And if we can't safely discharge them from the hospital, they stay in the hospital. And so we can move them around our health system, but that's probably not the most efficient use of the resource. And so I think setting expectations with family, number one, is the most important. But this is a very debilitating disease and disease process that takes time. And so I think it would be beneficial if we got to that point where it's really starting to tick up a little bit. And for us, we're starting to see a few more of them on a daily basis where families unsure if they can safely take care of at home for some amount of short time.
Okay.
And Judge, if I may add, I think that that's a very good question. And I think that working collaboratively, we can organize the different needs and then be able to categorize them, prioritize them, because the funds that have been made available, thank you for your leadership in helping us get those funds available to the county. I think that we need to work together with you and your staff to categorize what those needs are, prioritize them, because the funds are finite. There's just a certain amount, and the needs are very, very high. So I'd like to request that we continue our collaborative conversations and be able to organize those needs and prioritize them, and then be able to allocate the necessary healthcare funds that have come to Hidalgo County to be able to take care of those needs.
Okay. Before I turn it over to the press for questions, anybody have any other comments? Commissioner or Ricardo, Eddie, anybody? If not, then I'd like to open it up for questions from the...
Go ahead in the middle.
I'll start. We have gone through the same process that Laredo went through to request the additional staffing for our nurses, and that's been our biggest goal, and that's why we're so grateful to our county leaders who have all fought for us to get that resource. At this point, every hospital is different, but we really care about our nursing ratios, and we care about our staff. We have a lot of fatigue going on with our nursing and technologists and other members of the hospital, and so we're trying to keep them safe. And we have not extended our nursing ratios beyond what we would normally do, really in an effort so that we can avoid burnout and keep our staff functioning as healthily as they can.
And we definitely have followed the same process in communicating with the staff what our needs are. Specific to nursing availability, the range of nurses that are, the information that we receive regarding the range of nurses that are available, it's a range because the state is also needing to work through those details to be able to procure the nurses either out of the state or within the state. There's, again, the number of nurses is finite, and then when we get a final number for Hidalgo County, then that information will be shared with all of the health systems, and the nurse ratios will be evaluated in order to ensure that these nurses are deployed to the appropriate facilities.
Yes, thank you for taking my question. Is there a consensus of what's leading to the surge of cases 3 months after the pandemic began? Is it family dynamics, cultural? Is it border crossings?
Eddie, I'm going to pass it on to you. He has the most information.
So, Eddie Olivares, Hidalgo County Health Human Services. I think the general answer for that is just community spread. The reality is when you sit down and you look at the fact that we have over 3,000 cases since March 21st, and there's been over 40,000 tests completed. The focus is primarily going to be community spread. There's a lot of people who've traveled to other parts of the state and returned. People have gone on vacation, returned. And then you have the family unit. The family unit itself is the family unit. okay, is when you have one or two people in the household who may be infected, the probability of others in the household is high. And then the large family gatherings. I mean, there's a lot of things after Memorial Day, graduations, 4th of July coming. There's been a lot of events where people get together. So I think the availability of the virus to be able to spread to others has been very easy to do. So I don't think there's any one focus as far as international components. Borders have been closed. There's been limitations on borders. So I don't see that as being a primary issue. The primary issue is just amongst ourselves in the community.
Eddie, talk very briefly about the 112 clusters we have, just very quickly.
Actually, I think our clusters has gone up to about 120.
Oh, 120,
so,
okay.
yeah, let me double check. So our cluster count is between 115 and 120, where when you look at clusters, you might have as little as 2 to 3 people that may be partners and may be infecting each other or family members, to as high as 12. I have one case that we're looking at that we know directly that person may have been the source contact to infect as many as 12 other people. So those clusters are important to understand how they affect everyone in the community. For example, so say that I'm one, but if I affiliate and associate with a group of other folks and do not wear masks, do not keep social distancing, don't wash my hands, the likelihood of that virus passing from one person to another is higher. So that's what's happening. So the young people, our data, our numbers are very clear that the highest percentage of cases that are positive are 20 to 30-year-old range. They're the highest levels of positives. However, that in turn has impacted, when you look at the highest levels of inpatient care, acute care, they have been senior citizens, people above 60 years old, in ICU and in the hospital. And we can tell you that we've had several fatalities in Hidalgo County that we can say that person wound up in the hospital probably because a family member infected them. And usually a single family member.
There's many households in Hidalgo County that have 3 generations, grandpa, mama, pop, and grandkids. And sometimes the grandkids, bring that horrible disease to the rest of the family. At least that's part of what we're seeing. Okay, next question.
Hi, yes, Valerie Gonzalez, Channel 5. I was wondering if we could address testing availability. I have 2 questions regarding that. One, there was some talk in Washington about the funding, federal funding being affected for some sites across South Texas. Including Texas. I believe there's 2 sites, but that's hard to know. So I wanted to ask if you guys know if there's any federal funding that's going to be cut for testing availability in our area. And second, how reliant are we on antibody tests? So these rapid tests have been proving to be problematic in other parts of really the nation, and we don't have to look too far. Laredo had an issue. 60 Minutes had a special on it this weekend, but we all are well aware of the issues with antibody testing. How reliant are we? Are we asking people to test negative with those in order for them to go back to work, or are they kind of being phased out, and are we relying more on PCR tests? Thank you.
Let's break it down between the 2 questions. Anybody would like to answer the first question with regard to testing?
Well, we at UTRGV are continuing to test large numbers. In fact, as I mentioned earlier, we have 1,000 tests we'll be running today, and I'm sure this week. Those are just local tests. Those are not tests coming in from the state outside. We were going at about 100 tests a day a month ago, and we're 1,000 tests a day. We have reagent on hand. These are PCR, so these are the full RNA tests, the accurate tests. We have reagent on hand now, 25,000 sets. So we have ample supply to test whatever the needs are in the county. We have an ongoing supply of 10,000 tests per week, reagents per week. So in terms of PCR, we continue to ramp up. We're working with all of our hospital partners in order to help them with their needs. So we do not see any problem with anyone in our area that needs a test being able to get that test.
The next question regarding the antibody. Anybody?
I can address that as well. For antibody testing, We have the capability. We're really not doing much of it. I think the question is we're not sure what it means right now. We have very accurate testing available, but if you have a positive antibody, all it means is you've been exposed. We don't know if you're immune or not. We don't know how long that will last. We don't know any of that. We don't have quantitative antibody, so we can't measure the titers, the amount of the antibody. And without that, you really don't know what a neutralizing or an immune suppressant dose will be. So at least at this point, we're doing a few antibody tests, and until we figure out how to better interpret those tests, we're not doing it on a large or wide scale.
Just real quick, I completely agree with the dean. They're not reliable enough at this point. Just to answer some of your question, we are using those tests, again, more of an informational addition in the case of patients that we're looking at to consider for plasma donation, right? In those cases where maybe a family member or they don't know whether they were positive or negative or any of that nature, sometimes the antibody test can be used to say, maybe this patient was positive, they might be able to be a donor for plasma to get to somebody. So very limited under very specific circumstances.
Pues buenos días, Santiago de Canal 5.2. También la misma pregunta de mi colega Valerie. ¿Cómo seguirían las pruebas de COVID-19 disponibles en el estado de Texas, aún con ya no va a haber más fondos federales después de mañana martes? Es básicamente la misma pregunta, Valerie, pero por favor en español.
Health Director.
Eduardo Olivares, el administrador del Departamento de Salud y Servicios Humanos para el Condado de Hidalgo. Para nosotros mismos, los recursos que está notando usted mismo, no estoy seguro cómo va a impactarlos aquí el nivel del condado. Esos recursos se está decidiendo a qué punto va a afectarlos. Hoy mismo no puedo decirles si los va a afectar o no. Nosotros estamos de acuerdo con trabajando con el estado de Texas, que están dando las pruebas de PCR con las diferentes agencias militares, estatales, locales y federales. Estamos de acuerdo trabajando con ellos. Pero a este punto no reconocemos el impacto de los recursos que está discutiendo usted. A este punto no sabemos cómo va a impactarlos.
Hi, good morning, everyone. I was just trying to ask, I know that we've received a lot of messages, from people telling us that, why should it matter to us if the mortality rate is rather low? However, we know, and as I had spoken to other, medical specialists, most of the research we have at hand are from, instances that have happened in other places, in other countries, might as well, I'm sorry. And so, is there a concern when we're speaking about the impact that COVID-19 might have here locally, considering that most of us are Hispanic and most of us know someone or it runs in our family, whether it be diabetes, obesity, and stuff like that?
Ladies first.
Yes. Thank you. We are all very concerned about the mortality rates, especially in the Hispanic population, which makes up the majority of the population here in the Rio Grande Valley. And so it's very important for us to be in tune and understand that data, that information. But let's bring it more to a more personal level. What's important to us is very heartfelt, because our nurses are caring for these patients every single day, 24/7. And when there is a mortality at the hospital, these nurses are the ones that are holding the hand of that individual and caring for them. Because during this COVID situation, other family members are not able to be there because we don't want them to be in an environment that they might end up getting contaminated. So from a data perspective, yes, we're all very in tune and very concerned about mortality rate within the Hispanic population. But on a daily basis, it's a heartfelt situation, and therefore we ask the community again to do their part and take personal responsibility in helping us be able to get through this. Thank you.
I want to add on that is, what are the top three things that we see in the fatalities? Number one, obesity. it's been pretty standard. Number two, severe diabetes. Severe diabetes. And then, of course, cardiovascular disease. And, of course, pulmonary disease. So when you look at those four, and then you combine age with that, it becomes very difficult.
Judge, if I might add, this is the other thing. What we're seeing right now is younger folks presenting to the ICUs, and unfortunately, younger folks passing away from COVID virus. So one of the messages to our entire population is, especially those under the age of 50, let's say, you're not immune. It's more infrequent, but you are not immune to the ravages of the COVID virus. And I'll also tell you this based on what my experts have told me. As we continue to see the rise in numbers, there's literally, and please confirm or affirm if y'all can, there's literally going to be a 2 to 3 week lag before we see the mortality rates continue or spike because of what we see today. So as we look at our cases today and understand the significant spike, we can expect and anticipate the mortality rates to continue to go up. And then lastly, if we can save one life by our public doing what we're asking them to do, by gosh, it's no sweat off anybody's back to put a mask on. And if you're a member of the family of somebody who's passed away, that's one too many, right? So I appreciate the question. It's allowed us to hopefully lay that out for you. If you have any other questions related to that, though?
So hold on. What's important to piggyback what he said and Al said, there's one big piece, convalescent plasma therapy. Very, very important. The convalescent plasma therapy is critical to save lives. So people who are enrolled in that program are personally responsible for saving lives. We know that we have clients in Hidalgo County, upwards of 6, that have been, their lives have turned around because of convalescent therapy. So I cannot advocate for that program enough. Thank you.
Ok, solamente si alguien me podría repetir en español la capacidad de los hospitales, cuándo se va a alcanzar el 100% de esta capacidad y cuál es el plan que se tiene en caso de que se saturen los hospitales aquí en el Valle de Texas.
Voy a tratar de contestar en español. La capacidad de los hospitales ahorita estamos bien todos, pero necesitamos que la comunidad los ayude y que se protejan con las máscaras, lavándose las manos y la distancia. Porque si continúa en este mismo rápido estado, entonces sí va a haber problemas. Y sí, ya estamos pensando qué podemos hacer en el futuro con otros lugares para poder servir la comunidad, pero no queremos llegar a ese punto. Ahorita podemos hacer la diferencia y si toda la comunidad los ayuda, entonces nosotros los podemos ayudar a ustedes también. Gracias.
Our last question.
Thank you. So I had a question about, a request for the governor for more National Guard forces to be deployed. This was something that was announced by Representative Vela and also Gonzalez. Does the county agree that we need those more resources? I mean, it sounds like from everything that we've been hearing this morning, all the help that we can get is probably welcome, but I wanted to ask for any input from the county on this formal request that has been sent to the governor by, again, Representative Vela and Gonzalez, and if any one of you could address that, I'd appreciate it. Thank you.
Sure. Well, my response is very easy. Any resources, any help that we can receive from anybody to help us serve and mitigate the spreading of this disease, we want it. I believe that we're already receiving some National Guard military people that are helping in testing. That has been a huge success because, I mean, we're just tested more. So yes, we welcome any help any way we can get it. But I think what I've heard today and what I hope that you go back and tell the people of our communities is the most important message that you receive today. It's under their control. They're the ones that are going to decide what's going to happen to them. If you take the necessary precautions, you follow the protocols, then you're not only helping yourself, but you're helping everybody else around you. So absolutely, we welcome that help from the military.
And with that, that concludes today's press conference. Thank you all very much.